Welcome back to Living 808. If you're in need of an X-ray, an MRI, or a CT scan, you don't have to go to the hospital. You have a choice on where to get these images done.
Yeah, today we're learning about Hawaii Diagnostic Radiology Services. They offer outpatient imaging services and a ton of experience. Here in the back room with Dr. Kosit, and you have some amazing equipment.
Thank you.
But tell me a little bit more about this place, because the equipment goes along with it.
Sure, yeah. Hawaii Diagnostic Radiology Services was originally Yo and Muranaka Radiology. We're a locally owned company, and this year's pretty exciting for us. It's our 50th anniversary of serving the community. We are a physician-owned group, and we provide comprehensive outpatient diagnostic imaging services to include MRI, ultrasound, CAT scan, X-ray, and mammography.
How is outpatient radiology or imaging different than inpatient imaging?
When a patient has to have an imaging study done, they can either have it done at the hospital or at an outpatient center such as this one, and patients have a choice of where they want to go. Outpatient imaging provides a comfortable, more relaxed, and more accessible office-type environment where the patient can go to, similar to just going to their regular doctor's office. You know, sometimes if you go to the hospital, it can be a little bit of a hassle. Parking can be an issue. Just getting into some of those larger buildings can be a pain, and then navigating around the hospital can be really challenging. And that's at a time where either you're not feeling well or you bring a loved one that maybe doesn't feel well, and that adds to the challenge. So outpatient imaging really is more accessible in that respect. And the other real big thing about outpatient imaging is the cost savings. A lot of patients don't know this, but having your studies done at an inpatient center or at a hospital actually costs significantly more than having the study done at an outpatient center such as this one. Insurance companies can bill up to double and sometimes more for the exact same MRI that's done there as compared to here. And that cost is actually transferred to the patient eventually. So for ease of access and potential cost savings, having the studies done in an outpatient center is really the best thing to do for the patients.
Thank you for that. That's very informative, and I'm sure a lot of our viewers would love to know about that. I also have had many MRIs, unfortunately, over the time that I've played sports.
Sorry to hear that.
Yes, thanks. But tell me the difference between an open MRI and a regular MRI.
Yeah, sure. There's a lot of confusion about that out there. These days, when we talk about open MRI, we really mean open bore or wide bore MRI. And the bore is really the opening that the table goes in and out of. In the old days, some of the older machines, those bores were about 60 centimeters. So if you've had an MRI in the past and you felt like your nose was right up against up against the machine, that's not a comfortable experience. Patients get claustrophobic. There's a lot of anxiety. So that was probably done on one of those machines. And those machines are still used all over Hawaii and on the mainland as well. That's not the issue with the newer machines. The newer MRI technology has a 70-centimeter bore. It's an open bore and open MRI technology, and that's the machine that we have here at our St. Francis office. So a larger bore, more comfortable for the patient, less claustrophobia, and they have a better experience overall.
You get to listen to music while you're in there too?
You can listen to music, whatever station you want.
Sounds comfortable.
Yeah, it's very comfortable. Some people go to sleep in there.
All right, so MRI, somebody has questions after they've gone through the whole process.
Sure.
How do you guys help them out?
Well, patients can always get a copy of their report and of their images at any time. At HDRS, we also have a secure online patient portal where from home the patient can log in and get access to their images and to the report at any time. I think the one thing that really sets HDRS apart is that we have physicians, our radiologists are here in-house when the exam is being done. Maybe you're an older patient who has a concern about cancer. Maybe you're a younger athlete, a baseball pitcher who's recently injured his elbow. There's questions after the exam. And patients don't like to have the exam done and wait 2, 3, 4 days to go back and see their doctor for an answer. So we're here. When the patient finishes their exam, if they want to come in and talk to us, we'll go over the images with them, we'll talk about the findings of what we see, and hopefully answer all their questions and alleviate some of that fear and concern.
Dr. Shep, thank you so much for the information.
You got it.
I'm sure our viewers will love to hear all about it, and we appreciate you taking us around, showing us around, and telling us a little bit more about Hawaii Diagnostic Radiology Services, and you can come here to see them at St. Francis. Thanks. So the big thing here is that some of the new machines that they have, and I've been in MRIs where I get claustrophobic. Well, some of the new ones now have so much more room, way more comfortable when you have to lay there for 20, 30 minutes. Because it gets loud. It can be claustrophobic. I mean, I've been in there where it's, you know, you're looking at the top of the thing like that.
Yeah.
And so, new equipment, great facility, and knowledgeable people.
Great. It's nice to know that you have options,
Yes.
right? And I also really love that you can speak to a doctor right after to go over the results.
I also
you know?
like the fact that those results are made available to you online and that you can log on from home, especially if you need to share them with anybody, like a physical therapist.
Yeah, convenient.
Yep.
All right.